Okay, good evening, ladies and gentlemen. Welcome to our second topic for the Autism Family Support Group. This is an advocacy training by Autism Response PH about basic life support, CPR Angel, preventable injuries, first aid to seizure. Once again, thank you so much, Ma'am Josie Ortiz, for inviting me for the second time. Okay, let's talk about the Autism Safety Program. Overall mortality in 2008, Danish researchers found that the mortality risk among autism population is twice as high as the general population. In 2001, a California research team found elevated deaths in autism and attributed it to several causes, including seizures and accidents such as suffocation and drowning. That's according to National Autism Association. Next, children with autism are 40 times more likely to die from preventable injuries. That's from the Autism Community in Action. Okay, so our topic will be focused on seizures, accidents, like drowning, and other injuries. According to Maureen Benny of Autism Awareness Center Incorporated, the three main causes of early deaths in autism is epilepsy, suicide, heart problems, and cancer. And let's remember, education brings positive change to the lives of those affected by autism and autism spectrum disorders. Right here, we have what we call the CPR Angels. This is Robert Merrill, who performs CPR. He has saved 3 lives just being in the right place at the right time with the right knowledge. And he said, "It was the longest 4 minutes of my life. It felt like eternity while maybe doing the CPR by that time." He learned performing CPR by watching Rescue 911. Next, another CPR angel. This is Brandon Williams, who performed the Heimlich maneuver, an emergency technique to eject a piece of food out of someone's system. He saved his friend's life from choking to death. You can watch his YouTube link, as you can see from this presentation. Next, allow me to share my credential as a basic life support trainer from Philippine Heart Association. This is a updated certification for 2021. Okay, now let's talk about heart problems, and let's focus on what we call cardiac arrest and the heart attack. So let's talk about cardiac arrest and heart attack. So what's the difference? Cardiac arrest is an electrical problem. Cardiac arrest occurs when the heart malfunctions and stops beating unexpectedly, while the heart attack is a plumbing problem. A heart attack occurs when blood flow to the heart is blocked. Cardiopulmonary arrest. Failure of the heart to pump blood, compromised oxygen delivery to the entire body, leading to loss of function within minutes. Let's remember, time is critical. 0 to 1 minute, cardiac irritability. 0 to 4 minutes, brain damage not likely. 4 to 6 minutes, brain damage possible. 6 to 10 minutes, brain damage very likely. More than 10 minutes, irreversible brain damage, or if the victim has no pulse, no breathing for 1 to 2 hours, the victim is probably dead. What is CPR? CPR is a cardiopulmonary resuscitation. Consists of chest compression and positive pressure ventilation, or what we call the mouth-to-mouth. What is an AED? AED is an automated external defibrillator. Here are some photos when I went to Osaka, Japan. I'm a tourist for AEDs. Every corner or most of the establishment there has an AED or AED equipped. Question: is your school, office, or your kids' therapy center, are they AED equipped, or are they following the Department of Labor standards, such as having a safety officer from their therapy center, or school. As you can see, I'm a tourist for AEDs. I have photos of it. Okay, and AEDs comes in different types and shape. Some are equipped with a voice prompt. Others are voice prompt together with visual prompt. And this is the AED signage. As you can see, the red and white AED with the heart and the thunder-like icon. That means to say that this facility or this establishment is equipped with AED. CPR and AED. Let us remember, CPR alone is not enough, so you need an AED to complete the basic life support cycle or the basic life support chain of survival. Okay, and basic life support is the level of medical care. What does an AED do? Okay, let us remember about the shockable rhythm. As you can see from this photo, it tells us that it has a irregular heartbeat, or it is in a state of ventricular fibrillation. Do we need AED for this? Yes, we will give shock. This is what we call the shockable rhythm. And after giving the shock, the heart will pump normally. Next, asystole, or what we commonly known as a flat line. Okay, flat line. And do we need AED for this? Okay, from the previous slide, we only give shock to those who has a ventricular fibrillation. Okay, so this time AED is not required. Okay, viewers' discretion is advised. Please observe the following videos and I leave the judgment or comments to you. Contrary to the movies, a shock should not be given during asystole or flatline.
Nurse! Nurse! Nurse yung nanay ko! Nurse yung nanay ko! Nurse yung nanay ko! Oh! Doc yung nanay ko! Nay!
No pulse, code blue, start CPR.
Okay, no pulse, cold blue, start CPR. Okay, next video. Again, viewers' discretion is advised. Okay, now we understand that it is contrary to the movies that shock should not be given during asystole or flatline. Now that we know. What happens during cardiac arrest? Okay, let us remember that time is critical. On the chart where you can see there's only AED given without CPR, and AED was given about 10 minutes, so the rate of survival is very low. But if the victim was given a CPR then followed by AED, his chance of survival is very big. As you can see here, 30%. The sooner the better. Let us remember early CPR and early AED, the higher the survival for the victim. Rationale for CPR. Most of out-of-hospital cardiac arrest or OHCA occur at home. 10% OHCA or out-of-hospital cardiac arrest witnessed by EMS. Other is 31%, which is witnessed by bystanders. And 59% is unwitnessed. Always remember to know your nearest emergency medical services and hotline numbers. Okay, so you can save a life from a sudden cardiac arrest by calling 911 or the nearest emergency center. You start CPR, and if you have AED at home or at your workplace, give the patient the AED. Now let's talk about the autism water safety. Why do we need to know this? Okay, so let us remember, when a child is missing, search for water first. Okay, this happened in a barangay Bahay Toro. You can YouTube search this person with autism, female, was reported missing. They look around on the street, but later on in the afternoon, with the help of Philippine Coast Guard, they found the child at the creek. Okay, so drowning may result in an acute asphyxial cardiac arrest. So if this happened, you will still perform the basic life support with chest compression and ventilation or mouth to mouth. Okay, history of CPR. The Mona Lisa of Sin, or Resusi Ann, and the most kissed girl in the world, also known Il Inconnu de la Sin, unknown woman of Sin. Her body was pulled from the river Seine in the late 19th century in Paris. No name, no history, and no story. This is Resusi Ann. Okay, in 1960s. The history of CPR started way back 800 BC, and the first portable external defibrillator was invented in 1950s. Okay, I will show to you who is Resusi Ann. This is Resusi Ann. Okay, the most kissed, okay, woman. Okay, so you give ventilation, so you need to put your mouth on her. Okay, but later on, I know you have a question about how about this pandemic. What are we going to do about CPR? Okay. Another history of CPR, international consensus on cardiopulmonary resuscitation and emergency cardiovascular care science with the treatment recommendation, or ILCOR. Okay, they give guidelines or new updates every 5 years. Major changes in 2005, compression ventilation ratio 30:2 from 15:2. Okay, when we say 30, this is the chest compression, and 2 is the ventilation or the mouth to mouth. In 2008, bystanders allowed hands-only CPR. Then in 2010, the ABC or airway breathing circulation or chest compression is changed to chest compression or circulation, airway breathing or CAB. Compress harder and faster. Okay, and another history of CPR in the Philippines. Philippine Red Cross started April 1947 and followed by the Philippine Heart Association in 1982. And me, I joined the Red Cross back in 2005 from the Summer Safety Institute, where I learned my basic life support training and standard first aid, and of course the certification for lifeguard course, which I finished the 1 mile open water swim. Let's talk about the Republic Act number 10871. Okay, this is the Samboy Lim Bill, which is lapsed into law in last July 17, 2016. And it is also, I advocate this 10871, that opportunity to participate for person with autism or individual with disability shall not be denied the opportunity to participate in such programs or activities. Of course, you give the training on basic life support in age appropriate level. And April 25, 2016, there was the nationwide mass CPR Ready Philippines campaign. And another one from Republic Act number 10871 and RA 7277. Okay, so I advocate this, that we need to teach our kids, okay, person with autism, a basic life support training. Okay, this is passed into the law Republic Act number 10871 and RA 7277. Now let's talk about the chain of survival. Early access, early CPR, early AED is all what we need for basic life support. Okay, so first chain is the immediate recognition and activation. Second chain is early CPR. Third chain is rapid defibrillation. On the fourth chain is the effective advanced life support or the arrival of EMS. Next, integrated post-cardiac arrest care or transfer to the definitive care. As you can see on the box, this is our basic life support. These three key factors, the call first or early access, early CPR, early AED. Then when it comes to infant, it is interchange, safety first, care first, then you give CPR, then the third chain is you call. But if you have somebody at home, always call first and you perform or you focus on the child. You care first and you give CPR.